Hello and welcome. I'm Ashley Hawes, the Director for Consumer Information at Benjamin Rose Institute on Aging. Thank you for joining us today for Midterm Elections, Prospects and Implications, presented in partnership with the Elder Justice Coalition. This webinar will be recorded. You may submit a question at any time using the Q&A or chat feature on the bottom of your screen. We do have staff monitoring to convey your questions to our presenters and to answer any technical questions that you may have. You can turn on captions by selecting Live Transcript, the button with two C's at the bottom of your screen. At this time, I'm going to turn it over to Orion Bell, Benjamin Rose President and CEO, who will introduce our speakers. Orion?
Thanks, Ashley. This morning, I'm pleased to say welcome and thank you to Bob Blancato and the Elder Justice Coalition for their continued support in making this webinar and these other policy webinars possible. Today, we have the pleasure of hearing from Bob to give us a national perspective on the implications from last week's midterm elections. Bob is the president of Matz Blancato and Associates, and in that capacity, he also serves as the national coordinator of the bipartisan 3,000 plus member Elder Justice Coalition and the executive director of the National Association of Nutrition and Aging Service Programs and national coordinator of Defeat Malnutrition Today Coalition. Also joining us today is Lark Ritchie. Lark serves as the CEO of the Ohio Association of Area Agencies on Aging and Direction Home, an LLC, a limited liability corporation owned by Ohio's 12 area agencies on aging. She has previously served in many positions in the field of aging, including director of the Central Ohio Area Agency on Aging and vice president for senior housing at Community Building Partners. She's held several state and national board appointments and committees related to serving older adults and people with disabilities. I'm now going to turn the program over to Bob to get us started. So Bob, take it away. Bob, you're muted, I think.
Okay, sorry. I just realized I was on mute. After 3 years, you think you know better, but okay, sorry, Anyway, Orion, thank you for the introduction. I am delighted to be part of this webinar. Let's go to the first slide and say thank you to Benjamin Rose Institute on Aging, led by Orion, for being our primary host. And we at the Elder Justice Coalition are very pleased to co-host this. I'm delighted to be joining with Lark. So, my first thought is so many people have different reactions to this election, such as a relief it's over and it went well, and amazement on how close it turned out and how long it took some races to call. So on that point, let's talk about the House. Next slide. I wrote this slide a day and a half ago. Sent it out. I think we sent it out yesterday. Well, it is over now. Okay, since yesterday, it is now over. We now have the 218 seats that the Republicans have captured. That gives them the majority in the House. The ratio now is 218 in the Republicans, 211 Democrats, with 6 races to be decided. But I think the thing to think about is the margin of the majority. If it ends up being less than 20, it's going to force some changes, including the possible return to bipartisanship and the enhanced role of moderates of both parties. Now, on the next slide, we'll talk about the Senate, where we did get the earlier indication over the weekend that the Senate majority will remain with the Democrats. The only question that's left is, will it be 50-50 or 51-49, which will be determined by the Georgia runoff on December 3rd. And I assure you, for those of you who follow Congress, there's a huge difference between a 50-50 and a 51-49. 51-49 reduces the impact of certain individual senators who have been dictating and derailing agendas for the better part of a couple of years. It also leads to more seats on committees for the majority if you have that extra 1 seat. Or, very importantly, it will result in more confirmations occurring, whether it's in the judiciary or in the cabinet level positions. And I would also point out that one of the first things we noticed that the majority leader, Chuck Schumer, did after recapturing, if you will, the majority, was to reach out to Republicans to talk about next year and what could be done together. Next slide. So let's also talk about what happens when in these elections, changes in committee leadership. Okay. And for those of us who work in the field of aging, there are certain committees that are more important than others. In the Senate, there'll be fewer changes since the majority stays the same. However, the two biggest changes happen to be on two committees of great importance to those of us in the field of aging. One is the Appropriations Committee, which will now be chaired by Senator Patty Murray of Washington State, who is a longtime advocate of aging programs and aging services. And these are the ones who provide the dollars from year to year. And the Senate Health, Education, Labor, and Pensions Committee, or the Senate Help Committee, is expected to be chaired by Senator Bernie Sanders of Vermont. Now, on the next slide, you'll note that we have history with both Murray and Sanders in terms of their interest in aging programs, especially the Older Americans Act. Senator Sanders actually chaired the subcommittee that produced the last reauthorization of the Older Americans Act. And just getting a little bit local, your Senator Sherrod Brown would remain chair of the Banking, Housing, and Urban Affairs Committee unless there's a change on the Senate Agriculture Committee, which could happen. Senator Stabenow is the current chair of the Senate Agriculture Committee. She's being considered for leadership position in the Senate. If that opens up, there's a possibility of a change. And why that's important is that we're tackling the all-important Farm Bill in 2023, one of the largest domestic programs that we deal with in Washington. And I would also note your newly elected Senator Vance is likely considering his committee assignments right now. And I think as advocates, we should track that very closely so we know where he ends up. Then on this next slide on the House side, it's not so early anymore, I guess, because we have some ideas as a result of them getting the majority. But we know that two of your House members from Ohio will emerge with new power. Congressman Jim Jordan could end up being the chair of the House Judiciary Committee, and Congressman Gibbs could be a high-ranking member of the House Transportation Committee. But other major committees, Ways and Means Committee, Appropriations, Energy and Commerce, they will all have new chairs. And at least two of those three, Appropriations and Ways and Means, will both have chairs from the state of Texas, which suddenly got very powerful as a result of this election. Congressman Brady from Texas will be chairman of Ways and Means, and Congresswoman Granger will be chairman of the Appropriations Committee. But there's still many decisions that have to be made by both Republicans and Democrats on committee and, importantly, subcommittee assignments. And in the spirit of breaking news, we have just learned this morning, and actually this afternoon, that the current House Speaker, Nancy Pelosi, will not be seeking a return to any leadership position, as also the House Majority Leader, currently Steny Hoyer, also apparently announced that he too will not be seeking to be in leadership in the new Congress, which will open up many opportunities for younger members to come forward who have been aspiring for leadership positions in the House. So let's go to the next slide and talk about some of the aging issues that could occur in the new Congress. And I think it could be a very busy year. Funding for fiscal year 23, which actually began on October 1st, still might not be resolved when the new Congress starts its work on January 3rd. And as we will discuss later, the goal here, whenever FY23 is resolved, is to avoid a service cliff in aging programs caused by sharp reductions in funding due to moving away from emergency pandemic funding to regular appropriations. Because the cliff is the difference in the size of the funding between the pandemic dollars and the regular appropriations. But we do know that fiscal year 2024, which begins September 30th of 2023, that will be coming up. That budget will be out in the spring, and we'll be focusing our attention on that as well. And then in the next slide, we expect a fair amount of activity in Medicare in the new Congress, particularly now in the first bullet because of what happened with the House now capturing the majority. You know, there was a lot of opposition to on the side of the Republicans to having first-time negotiation of prescription drugs under Medicare Part D. That was part of the Inflation Reduction Act, which passed only with Democratic votes. And one of the first things that may be challenged is that entire law from a legal standpoint. the assumption is when the regulations come out to implement that, that's where a lot of the challenging will take place from a legal perspective. They could also just try to repeal the law completely. It's not clear at this point. We can absolutely expect deeper oversight into Medicare Advantage programs because there seems to be a growing concern on a bipartisan basis, actually, about how some of the plans are marketing their plans, the rapid growth of the plans. And so Senator Wyden, in particular, the chairman of the Senate Finance Committee, has been very aggressive in seeking answers from these plans about their marketing practices. Now, the Senate may still want to go back and try to focus a way to expand Medicare to cover dental and hearing. And this may take on new impetus because of the ruling a couple of months ago by the Food and Drug Administration to allow over-the-counter hearing aids to be made available to the general public. Their response has been very dramatic. We certainly expect that that market is going to grow. And since Medicare Advantage currently does cover a lot, over 90% of the plans cover either hearing aids or hearing exams, the pressure will be on why doesn't regular Medicare do the same thing? And so this one should be watched pretty carefully as the year progresses. We can certainly expect discussion around how to make a lot of the telehealth expansions that were done in the pandemic, which ones should be made permanent and for how long. Okay? And then finally, I do expect increased discussion around Medicare coverage for food as medicine programs. That was discussed, that we'll talk about that a little later as to where that first came up for a serious discussion. The next slide talks about another issue that sort of was quiet until the very last days of the campaign. And there were proposals put on the table that were reported about changing Social Security, including the very controversial idea of raising the retirement age to 70. Those of you who know, in 1983, Congress raised the retirement age from 65 to 67. And the point then and the point now is there is, in the era when we are talking about equity issues, you put a proposal like that on the table when life expectancy for African-American older adults and Hispanic, most non-white older adults, their life expectancy is less. And so you raise the retirement age, you're building in discrimination of the highest order, frankly. So what's going to be a key here? Every year, the Medicare trustees and the Social Security trustees put out a report. What condition are we in as we go through into 2023? It's called the date of doom, for lack of a better term. When does Social Security not able to pay its full benefits? Okay. What year will that be? If it moves up from the current 2034 to 2033 or 2032, that's going to really prompt people to look at Social Security reform. And I can guarantee you the first thing you'll hear the Democrats talking about is before you do anything, you should be thinking about raising the income cap on Social Security taxes. What that means is, let's say that you're fortunate enough to make $500,000 a year. You're only paying Social Security on the first $147,000 of that. Somehow that seems something that's ripe for reform. But the problem is, historically, Social Security is never reformed in a piecemeal way. It's done in a comprehensive way. So this one we're going to watch very carefully as well. The next slide, an emerging issue that I know Ori and I have talked about a number of times, and we focus a lot on this, is this whole issue about nutrition security. We just completed a White House conference on hunger, nutrition, and health that was held in late September. So amazingly, the first one of its kind since 1969. And the conference was not at all age specific, as the issues around hunger, nutrition, and health are relevant to persons of all ages. But as advocates for older adults, we worked to make sure that their issues were included in the conference. And on the day of the conference, the White House National Strategy on Hunger, Nutrition, and Health was announced. And that's what's going to ground the all-important work that comes from the conference. And on the next slide, we'll show you exactly what those recommendations on older adult issues were. I'll just focus on a couple of them. Well, number one is most immediate. The need for increased funding for the Older Americans Act Nutrition Program, especially in fiscal year 23. And we're going to give all of you a little bit of homework near the end of our presentation about what you need to do to help make sure that funding is adequate in FY23. The one that's also very important is the promotion of universal screening for food insecurity. And I will tell you, it's also malnutrition in that same space, really, in federal healthcare systems, as well as incentivizing other payers and providers to screen for food insecurity and other social determinants of health. Again, these are recommendations released by the White House in conjunction with this White House conference. And then the other part that we're interested in is creating a federal research agenda for older adult nutrition that will be led by the Administration for Community Living. And they will be bringing external people in addition to federal officials into that agenda. So the next slide, briefly, other upcoming aging issues. I alluded to the Farm Bill because of the fact that it is the program that funds the SNAP program, the Commodity Supplemental Food Program, the Senior Farmers Market Program, and others. And this Farm Bill will be more important because of the increased focus on nutrition and health. And work has already begun on the Farm Bill, but it's going to get intensified as the year progresses. We can certainly expect the discussion around Medicaid and what happens after the public health emergency ends, whether that's in January or in April. There's huge implications for Medicaid and Medicaid expansion that will have to be addressed after the public health emergency ends. And then finally, of great importance to us in the Elder Justice Coalition is the need to reauthorize the Elder Justice Act. If it isn't done in 2022, certainly it's going to have to happen in 2023. Next slide. So I think we also have to keep in mind that, policy is made both by Congress and by the executive branch. And with a divided government that we now have, we can expect very aggressive regulatory activity by the Biden administration, especially in the healthcare space. The Centers for Medicare Services, Medicaid and Medicaid Services, the Centers for Medicare and Medicaid Innovation will be particularly active, and they will continue their focus on equity. And for those of you involved in the Older Americans Act, Administration for Community Living has already said they intend to publish regulations for the Older Americans Act for the first time since 1988. But next slide, before we go to 2023 in any grade, we have 2022 to finish. And I know Lark has some comments on this too. We're having a lame duck session that just was convened on Monday to finish the work of this Congress. The top shelf issue, as I mentioned earlier, is funding levels for the rest of fiscal year 2023. Right now, we have a continuing resolution that funds the federal government only through December 16th. So you have 4 scenarios that you can end up with when it's all said and done. You could have another short-term continuing resolution going into early 2023. The passage of individual appropriations bill in 1 or 2 big omnibus bills, as they call them. A massive end-of-year package with appropriation bills and much more, or a full year continuing resolution. The worst scenario of the 4 would be a full year continuing resolution. The rest of it, there are opportunities for increases in the second and third approach scenario that we talk about. So the next slide, we'll talk about our concern and our issue about elder justice funding, particularly funding for adult protective services. One of the reasons why we think a omnibus bill will happen has nothing to do with elder justice, has nothing to do with nutrition. It has to do with whether or not earmarks are continued. Those are special projects that members of Congress get to put in bills that allow them to fund local projects. They were banned for a long time. They're back now, and every member of Congress seems to be applying for them. You cannot do an earmark in a continuing resolution. So keep that in mind as we look down the road. Now, the issue we're worried about is how to avoid hitting the service cliff in elder justice. And how would that be hit? If Congress does not provide at least $80 million for adult protective services, that will be where the cliff could happen. So let's look at 3 numbers to consider in this discussion. The first is the current funding level for elder justice APS. The next slide, please. $188 million is the current funding level for adult protective services for fiscal year 22. Now, again, keep in mind, these are not appropriation. These are emergency pandemic dollars. They're different than regular appropriation. So far, the Senate has proposed only $6 million for next year, but the House has put the $80 million forward. So the next slide tells you what you can help us do, and that is to contact Senator Brown and urge him to talk to his colleagues among the Senate Democrats on the Appropriations Committee and get that number up. 6 million is a 95% reduction in funding. You cannot function with that kind of a cut. And then you need to contact the Ohio House members on the Appropriations Committee on both sides to make the same pitch for $80 million in funding for adult protective services. And at the end of this presentation, there will be QR codes for you to do some of your advocacy right on the spot. Next slide. We also want to talk briefly about Older Americans Act funding, particularly around nutrition. Okay. Our National Association of Nutrition and Aging Service Programs and Meals on Wheels America are seeking a doubling of funding for the Older Americans Act Nutrition Program, as also for the Home and Community-Based Services Program, Title 3B of the Older Americans Act. This is where the pandemic disparity comes into play. The Older Americans Act Nutrition Program got $1.6 billion in pandemic funding over 4 bills, almost twice its normal appropriation. Well, the problems have not gone away. The need is growing. Inflation is impacting these programs. The need to keep as much of this funding as possible is critical. And that is why we have those requests out there right now. And then next slide, quickly. One more after this. Okay, no, all right, yeah. 2 other issues that we could just touch on quickly is, one is, are we gonna have to address the debt ceiling issue? Probably not in 2022, so we can move on from there. And then, of course, will the public health emergency be extended beyond January by this administration? And it has pretty important consequences to a lot of programs that we all know about. So finally, in closing, let me just say that it's always an important time for advocacy, but particularly right now, it seems to be more so, because we shouldn't lose sight of the fact that what people did in aging services and programs during the pandemic was remarkable. Remarkable selfless work that kept services flowing, that kept people fed, that took care of all the needs that older adults have at the community level. We can't afford to lessen or abandon those expansions because of reduced funding. So the job is, Congress needs to recognize this, but the best way to have that happen is to communicate the local impact of what cuts could mean for aging service programs. So with that, we will leave this slide up for a bit, the QR codes that will show you what you need to do, and we'll have this available to webinar participants. We'll forward these slides out. But this is a way you can communicate with your elected officials on funding for nutrition, 3C, on funding for adult protective services. And if you want any more details about what went on at the White House conference, that last QR code will give you that information. So Orion, with that, I will stop, and delight to turn the program over to Lark, I guess.
Thank you, Bob. We're actually going to pause for a moment to answer a few questions that we received.
Sure.
So I know that you have the QR codes here where people can click on those in order to advocate. Is there another way that people could be involved to advocate for the Older Americans Act and older adults on a federal level to avoid the service cliff?
There are a number of ways that folks can do it. I mean, the old-fashioned way is to communicate directly through email, through snail mail, through social media, whatever it may be, to your House and Senate members, to tell them that funding is important. What did the expanded funding for nutrition, what did expanded funding for Title 3B of the Older Americans Act, what did expanded funding for adult protection, what did it mean? What did it result in? Okay? And the more there are local impact stories that you can show. We put this number out all the time. We see areas that had doubling and tripling of their demand for meals during the pandemic. When all the congregate sites closed down, those same people had to be fed, and they were fed at home. and that increased a lot of costs for transportation and other things. But unless elected people see what it means locally, they may not get the urgency to make an improvement in the funding level. So direct communication is critical. For those who have the opportunity to invite elected people from the House or the Senate to come to a program and see for themselves what's going on and what things mean, that's also good. And we also tell people, you all have local newspapers, okay, and local media. Get in there, get your letter in there, get your communication in there, get on a news program, okay? Do something that allows you a platform to do your advocacy. So all the above should be done in the days ahead.
Thank you, Bob. Those are really great suggestions. Could you clarify for us, what is the Farm Bill?
Oh my goodness. Well, the Farm Bill is a law that comes up for renewal every, I guess, 5 years or so. It is the single largest agriculture bill we deal with in this country. It provides funding for farmers and production and crops and incentives for them to do their work in growing different crops. But most of the funding for the Farm Bill is in domestic nutrition programs, including the ones I mentioned, like the SNAP program or the food stamp program, as you may know it, and the Senior Farmers Market program and the Commodity Supplemental Food program. I think something in the vicinity of 80% of the money from the Farm Bill goes to those programs. So when the Farm Bill comes up, it's about extending those programs for a certain period of time, 3 years, 5 years, and hopefully with more resources than they had before and more flexibility than they had before. What makes this Farm Bill more important, frankly, is two things. If you're in the farming business, you've got real challenges now because the value of land on farmland is growing dramatically. It's pricing people out of becoming farmers. And we can't afford to have that. If we don't have a robust farm economy with people of all ages engaging in it, it'll hurt our economy. We have challenges as it is now with supply. We need our farms operating at full capacity, and the Farm Bill should allow that to happen. And the other part is, since we are now making the linkage between nutrition and health, which we should have done a long time ago, frankly, the Farm Bill, through passing those funding and renewing those domestic nutrition programs, can do a lot to improve the health of our nation. So many chronic diseases that older adults have are a result, in some ways, of inadequate nutrition earlier in their lives. So I think now we have this opportunity, because of this White House conference, to make the Farm Bill a centerpiece of our future nutrition and health policy going forward.
Thank you for that clarification. We did have a question come in if you were able to talk about maybe who you thought might replace Nancy Pelosi.
Well, first of all, nobody will replace Nancy Pelosi. Let's be honest, okay? The woman's a legend. She's had the opportunity to be speaker 2 different times, the first woman speaker ever in history. She had the unenviable job of corralling a wild group of people called Democrats who are, in the House. And she did it with great leadership skills. Honed, by the way, people don't remember, everybody knows she's from San Francisco, but she actually was born and raised in Baltimore, and her father was the mayor. And she learned a lot about politics and, organization, watching him, frankly. The people that are being talked about include Congressman Jeffries from New York, who's a young congressman from Brooklyn, who's been aspiring for leadership for a while. There are Congresswoman Clark from Massachusetts is another possibility. But what you have to watch is, if there becomes a deadlock of some kind in terms of who can actually get enough votes to become, it would be speaker. Now it's minority leader and minority whip, okay? Person who's waiting in the wings, so to speak, without aggressively pursuing anything is Congressman Jim Clyburn of South Carolina, who is one of the elder statesmen, but he's one of the ones that everybody goes to and asks for his blessing as they seek leadership positions. Well, if all of a sudden they can't get enough votes for any one of them to get it, he could just slide in temporarily, if you will, until they can figure out where to go deeper into the future. So time will tell. They have leadership elections coming up pretty soon, and the Republicans just did theirs yesterday, I think. The Democrats will do theirs probably right after Thanksgiving, and we'll have a better idea then.
Thank you. And could you briefly talk about what kind of Social Security reform is currently being discussed?
Well, at the moment, all we had to discuss was on the campaign trail near the end of this midterm election. Reforming Social Security is a buzzword. Okay. First of all, the one thing from a messaging standpoint that we need to really remember, people like to say Social Security is an entitlement program. Social Security is an earned benefit. Okay. There's a huge difference in how you perceive your belief in Social Security when you put it in that context. Now, when you talk about reforming Social Security, your options are pretty limited. Okay. You can either lower benefits or raise taxes or do something in between, which in fact, it was tried a number of years ago. It's called privatization, where you take some of the Social Security trust funds and invest them in the private market. Second President Bush tried that, and it was a monumental failure. It cost the Republicans a lot of grief, and nobody seems to want to go back on that route again. So then, cutting benefits, what does that mean? Reducing maximum benefits to some degree, but also raising the retirement age as a cut in benefit. If you thought you're going to get your full Social Security at 67 and they raised the age to 70, that's 3 years that you lost your opportunity to get a benefit. So when they say raising, that's a benefit cut. Okay, that's one option on the table. But the other thing that I mentioned in the slide was that we have this bizarre limit on this cap, how much you pay in Social Security. You stop paying Social Security tax when you make $148,000 a year. Okay, so those people who make twice that much, 3 times that much, those numbers above 148, you're not paying Social Security on that number. And we could bring a lot of revenue to Social Security if you raise that cap and let more people pay in with more money. So here's why I think nobody's going to touch Social Security until they have to. And I'll give you this as my favorite example. If we did a word association game, and I said to you the word Congress, the next word out of your mouth would not be foresight. Okay, that is not the nature of the beast. Okay, they wait till the crisis is on the doorstep and then they act. So that's why I talked about the trustees report. The trustees reports come back with something really dramatically different about the condition of Social Security. Maybe they start talking realistically about Social Security reform, but not before that.
Thank you, Bob. We really appreciate your expertise and for clarifying for us ways that people can get involved and for all of those great suggestions that you made.
Thank you, Ashley.
Next, please join me in welcoming Ms. Ritchie.
Thank you, Ashley, very much. And a big thank you to the Benjamin Rose Institute, the Elder Justice Coalition. I appreciate being able to talk to you today. And Orion, I want you to remind me the next time we talk why I said I would follow Bob Blancato. I always learn so much from Bob, and I always appreciate being able to hear his take on issues. There's no one more informed than that. So if you go to the next slide, please. This is going to be Ohio specific information, but I want to go over some of the leadership changes first. But I think that as Bob and I were talking earlier, some of these things really apply probably nationwide as far as the issues that we're facing here in Ohio. So first off, there were no consequential cliffhangers in Ohio. Ohio is just getting a deeper shade of red. And we are seeing that because the supermajorities for the Republicans in both the House and Senate increased in this past election. But the leadership in the Ohio Senate is going to include Senator Matt Huffman, who is the current Senate president. He is a very strong leader. You can see that with all of the initiatives that he pushed and has either squashed or moved forward. And I think if you watch the redistricting discussion, you would also see what a strong leader he is. Senator Kurt Scheuring is going to replace Senator Hottinger as the president pro tem. Again, he's a very seasoned legislator from Canton. He definitely knows his ropes around the General Assembly. Senator Rob McCauley of Napoleon was elected the majority floor leader, and Senator Teresa Gavarone of Bowling Green was elected the majority whip. So again, quite a very experienced team that we have there in the Ohio Senate leadership. If you go to the next slide, you can see who the Senate leadership is for the minority party. Senator Nikki Antonio was elected as the minority leader. She is replacing Senator Yuko, who was term limited. She is a very well-respected legislator and will be leading the 7, yes, there are only 7 Democrats in the state Senate in Ohio, but she is well-respected across the aisle, and I think has a good relationship with Senator President Matt Huffman. So I would not rule out their ability to make a lot of changes in legislation. Senator Herschel Craig from Columbus is the assistant minority leader. And then we have 2 members who are moving to the Senate next session. So this is for the 135th General Assembly. And that's Representative Kent Smith from Euclid will be the minority whip. And Senator Paula Hicks Hudson from Toledo will serve as the assistant minority whip. So next slide, please. So then this is definitely hot off the press information from Ohio, because the leadership was just elected late yesterday. And there was a little bit of a surprise. It was somewhat of a contentious time. And there were 3 representatives in the running. There were 4 and 1 dropped out. And so what we've seen is that the Representative Derek Marin is going to be the next Speaker of the House. The interesting thing here is that he only has 2 more years. So he's kind of entering the speakership as a lame duck legislator, because he will be term limited at the end of this time. So that's kind of an interesting note, because I think you have repercussions for that. Representative Phil Plummer, who was also in the race for the speaker, is going to be Speaker Pro Tem. Representative Scott Wiggum from Worcester will be the majority floor leader. Representative Susan Manchester from Waynesfield in Southwest Ohio will serve as the assistant majority floor leader. And Representative Brian Baldridge from Southern Ohio will serve as the majority whip. And again, Representative Brian Stewart from Asheville. As I said, that the very seasoned Senate leadership, all of these are new to their leadership positions. They're strong legislators, but they are all new to leadership. So I think that creates somewhat of a little bit of an imbalance in between the Senate and the House, but things change. So it will be interesting to see what happens with that. And we have allies here, and we also have people we can convert to aging issues. So I'm excited for the next session, and I think it's going to be an interesting one. And I would just point to Representative Susan Manchester and Brian Baldridge in that leadership position has really taken an interest in some of our aging issues. And if you go to the next slide, you'll see that the House leadership for the minority party hasn't been determined, but it is pretty clear that Representative Allison Russo will likely remain the minority leader of the House. She replaced Amelia Sykes, and Amelia Sykes went on to recently win a seat in Congress from the Akron area. So let's move to the next slide. And I want to talk a little bit about lame duck issues and in Ohio. So these are all Ohio lame duck issues, but it's also, after we talk about these things, some of these things will not be settled in this 2022 session, and we'll move into 2023, which we all know you have to start all over again when that happens. And after we talk about lame duck, I'll talk a little bit about some of the aging priorities for the 2023 session as we move into that. So the governor has made it very clear children and behavioral health are his priorities when it comes to the Health and Human Services arena. That doesn't mean that he hasn't been supportive of aging issues, but he has definitely made it clear that these are specifically the things that he is going to maybe put forward new initiatives and promote. Other kind of hot topics that are going to be discussed in lame duck, which don't really relate to our issues necessarily, but are things that could suck up a lot of air in terms of what does get debated and move forward. One of those is abortion and changing the heartbeat bill to strengthen it, transgender sports for girls, criminal justice reform, marijuana laws. These are all things that are out there right now and being debated. And redistricting is also there, but I suspect that that will also be discussed more in the 2023, because as you know, our maps were ruled unconstitutional and we had to move forward with them. So there will be a redrawing of those maps as well. There is not a lot, it's kind of up in the air about what's happening in lame duck. I hear that not much is going to end up happening. And then on the other hand, we hear, oh, there's going to be a lot of things that go through. And I mentioned some of the more contentious ones earlier, but there's only 5 or 6 session days that are planned currently. They can always expand that. But the Senate really has said that December 13th is their last day. They have an as needed day on December 21st. So I don't think this is not going to be a run it out to the very end. That's a prediction. So it can always be wrong. They've already passed a bill that we had an interest in, which had to do with adult abuse, House Bill 419. And it makes it if you fail to make a mandatory report on adult abuse, neglect, and exploitation, it becomes a 4th-degree misdemeanor. What this did was really align it with what happens with child abuse. So that bill has passed and is moving forward. Now, the other bills I have listed here are things that we're watching and that we think could have some momentum. Representative Romer's bill, House Bill 600, has to do with PACE. And the expectation is that there will be $50 million in ARPA dollars that will go to expand PACE in Ohio. There's currently only one PACE provider in Ohio, in Cleveland, and that would expand it to a minimum of 6 sites, which would be Columbus, Toledo, Cincinnati, Akron, Lorain, and Dayton. And there's also interest in seeing if there could be a rural PACE site as well. So it hasn't had hasn't been scheduled for a hearing, but the PACE bill could also end up being an amendment added to another. So we're paying close attention to this. House Bill 572 addresses assisted living rate changes, and that would be based on Medicaid census and tiers. And there is a hearing on this today. And we know that assisted living is not reimbursed adequately in Ohio. And we know that there are plenty of Medicaid people who are on Medicaid who could benefit from assisted living, but because the rates are so low, assisted living facilities can't necessarily afford to take them in. So this, and I think it's a good idea, they're looking at increasing the rate with the increased number of individuals on Medicaid who reside in a facility. So again, I think that's a very interesting bill and one to look forward, and they are trying to get it through lame duck. Another one, House Bill 744, this is Representative Manchester, and that is to expand self-direction or consumer direction and streamline it. So I don't think that's had any hearings. I don't know where that's going to go, but it is out there. And recently introduced, Representative Liston introduced House Bill 751, and that has to do with nursing home discharge, and saying that in order to discharge from a nursing home, you have to have a safe place to go and services to be available. So nursing home rebasing has two bills in right now, House Bill 625 and Senate Bill 325. I suspect there will be some movement on that. And I wanted to just mention House Bill 560. I don't know if that's going to move, but it is to create an affordable housing state tax credit. And we all know housing is a really huge issue for not only for the people that we serve through our aging services, but the people who serve those people, the actual direct care workers. So we're going to support that, obviously. So if you move to the next session or next slide, there are likely, so ARPA right now, there are, and I have on here a tracker that the Ohio Poverty Law Center has. I suggest that you go to that. They are tracking ARPA expenditures, and it's very interesting to note how that's going. But if we look at all the federal relief dollars, there's $10 billion that hasn't been spent. So those things are out there. We fully expect that there's that the nursing facility funding for workforce and also the developmentally disabled have forward a retention bonus that the county boards are actually providing some match. We expect that will probably also move. So other ideas are around kind of direct care workforce. And this is a huge issue. Currently, when we surveyed the area agencies on aging across Ohio, it has increased from 2,000 in February of 2021 of people that are enrolled and eligible for a program, but were not able to be served, to what likely is around 5,000 individuals in that situation where they're able to be on a program, but there's no one to go out and serve them, primarily in personal care. So we have a couple of initiatives that we'd like to push around having an expanded homemaker program that would act $250 that an individual could get a homemaker, like a Molly maids or somebody who come in. If you can't have a personal care aide, at least get someone in the home to keep the home, clean, and maybe a monthly stipend or a voucher of some sort. And then we'd also like to see provider engagement coaches that could assist in reaching out and finding new providers across the, particularly in the Passport program and in My Care, to enable people to reach people in their community, people that may go to their church or maybe down the street. And once they understand they could have somebody help them walk through the process of becoming a consumer-directed provider, we think we could get more people. Leading Age Ohio has initiatives that they're promoting, $6 million to start for startup grants for adult day services. They took a big hit in the pandemic and they're really struggling to get out of that. So that's a problem. And I did mention on there's also $400 million of unspent home and community-based relief funds that are unspent. And this is according to the Legislative Service Commission. So if we move to the next slide, because I'm watching my time, there's just a reminder, the timeline is that all of the state departments are currently have submitted to OBM their budgets, and they're working through all this. The governor then puts it all together and will introduce his bill in February of 2023. Then, of course, it goes to House Finance and through the subcommittees, voted out, and then sent to the Senate and Senate Finance, and They then is also returns to conference committee, but we will have a new budget, if all goes well, by July 1st of 2023. So we will be focusing a lot of energy around that. To that end, the area agencies on aging have had 6 already, and another 6 are planned of the 12 area agencies to have provider forums where providers and individuals who are served but or maybe not being served, and legislators and the Department of Aging and the Department of Medicaid have participated in all of these provider forums. It's been a very interesting discussion across the state. Our Chief Policy Officer, Beth Kowalczyk, has sort of led this effort with the area agencies on aging, has done a fantastic job. And we're really raising the profile of this very serious issue. So in the next session, rates for direct care workers, we are proposing it should be $20 an hour for an individual who is working in somebody's home. What we're paying now in the $10 to $12 range in Passport is not sustainable. And we're seeing that in those serious numbers of the number of people who aren't being served. So that would necessitate at least a 50% increase in rates. Interesting, we have and Beth is leading this, Ohio Aging Coalition, that is among the statewide associations in aging are gathering, and they're trying to find what are the things that they align around. Number one top issue is the direct care worker rate, and making sure that we can get more people into the field of aging and the field of the care economy. So that, again, Adult Protective Services will need additional funds to address all the things that they're doing. They currently get $60,000 per county. They're asking for $80,000 per county. We want to see where this MyCare conversion language, for those of you who don't know, MyCare Ohio will be ending because the CMMI has said all the financial alignment projects will end by December 31st of 2025. And so in Ohio, that means MyCare Ohio will come to end, and the Department of Medicaid, excuse me, is busy working on with stakeholders and others on what is that going to look like. We expect some of that work that they're doing with stakeholders and that they're doing in looking at developing a new system to replace MyCare Ohio, that some of that language will probably appear in the budget bill as well. The proposal is to move to a FIDE SNP, which is a fully integrated, dual eligible special needs plan that would sort of combine the long-term services and supports as well as Medicare funding, and that people would be auto-enrolled to that. They can, of course, choose a different Medicare provider at some point. But I don't want to go into detail about that because honestly, that's like a whole nother webinar anyway. So that is what I have. And I know that was very quick, but I wanted to kind of go over. So that was, and if you go to the next slide, that just has my contact information and Beth's because she is really leading a lot of our efforts. So thanks, Ashley.
Thank you, Lark.
So Lark, I would really appreciate you sharing the information today and saying, even though it's Ohio specific, I think a lot of the things that you talk about at the state level are of interest to folks who are on this call that are not in Ohio, because things like PACE programs, the conversion of things like MyCare Ohio and these other demonstration projects and the conversion of those, these are conversations that are happening all over the country. And even a lot of the federal program we talked about, like Adult Protective Services and the Older Americans Act funding and those kind of things, those are decisions, implementation decisions that happen at the state level. And so even federal programs, a lot of the decision making and a lot of the impact is decided in state houses around the country, which is why it's so important to keep that state perspective in mind as we think about aging policy. So thanks so much. And you did a great job of following Bob Blancato. So thank you.
Well, I don't think anybody can follow Bob, but thanks for that.
All right.
Thank you for those comments, everybody. That was very nice.
We're going to take the time for a few questions. So just as a reminder, if anyone does have a question, if they could pop it into either the chat box or the Q&A feature at the bottom of the screen. So Lark, while Orion actually mentioned the PACE program, we did have a question come in. If you could just clarify what PACE is.
Oh, yes, it's the program for all inclusive care for the elderly. Right. So, and it is a fully integrated program. So it has a funding stream from both Medicare and Medicaid, and it comes in and it is all inclusive. It's actually a wonderful model in terms of wrapping around the services of an individual who is duly eligible for both Medicare and Medicaid. And it provides a whole range of health services and a whole range of long-term services and supports. It generally is centered in sort of an adult daycare model, but it is not adult daycare, it's way more than that.
Thank you. And speaking of adult day programs, so there were many that closed in Ohio during the pandemic. Is there anything we could do on a state level to get them open again?
Well, that's what, there are many of us who've been working on this, and we're in Leading Age Ohio, and there's an Adult Day Association. Certainly the AAAs are very concerned about this. This has always been a wonderful service, particularly for caregivers that work. It's made the difference between whether somebody can stay at home or go into a nursing facility. So there are going to be bills. I think we need to get the rate up for what adult daycare gets, but frankly, to kind of, make up for the damage that was done and all the numbers that have had to close, this idea that Leading Age is putting forward about startup grants is, how do you incentivize people to either get back into it or to start new adult daycare facilities? It's not available everywhere in the state. It's generally more available in urban areas, but it's a very important service. And so I think we'll keep people informed on what bills are out there. They are pushing in lame duck. If you're really interested, contact your rep and your senator and let them know that you would like to see this additional funds from ARPA for adult daycare.
Thank you. All right. Any final remarks from you, Lark, or Bob, or Orion?
Well, I'll just start by saying thank you very much for holding this webinar. Ashley, thanks for your expert moderation. And Orion, thank you for hosting, as you always do. And Lark, I'll follow you anytime.
Well, ditto to everything Bob said except for that last thing. So yeah.
All right. Well, thank you.
Before we sign off, I just one more comment. We had to mention this, especially in the Ohio part, about the focus around behavioral health services. And for those in Ohio that are interested in being more involved in behavioral health issues as they relate to older adults, we have a recently reactivated Ohio Aging and Behavioral Health Alliance, and to address behavioral health issues in the state. And we're pleased to see that the new state plan for aging includes a metric on tracking and addressing depression in older adults, and we think that's a great first step. If you want to know more about that, you can contact me at the Benjamin Rose Institute on Aging, or you can visit with the Mental Health and Addiction Alliance or the MAC in Ohio for more information about that. A number of area agencies on aging, Adams boards, and other service providers are part of that issue. If you're outside of Ohio and you're interested in the issue of behavioral health in older adults, check out the National Coalition for Mental Health and Aging. You can find that housed within the National Council on Aging's website, and you can get a directory there of all the state associations and who's involved in that to find out how you can be involved in advocating for behavioral health issues in your state. So
Thanks for your leadership on that, Orion. It's wonderful.
Clark, thanks.
Yeah, wonderful. Thank you. And thank you for everyone for joining us today. Again, thank you to our presenters for sharing such great information. In the chat, you will find a link for a webinar evaluation that we hope you can complete. Your feedback is really important to us. It helps us improve our programming. Your responses will be kept confidential and will not identify you in any way. We hope you will plan to join us for future events we hold throughout the year. Our next webinar, Preventing Caregiver Burnout, Creating Your Self-Care Plan, will be held on Wednesday, November 30th from noon to 1. On December 8th, please join us in person at the Benjamin Rose Conference Center for our annual caregiving conference. It's going to be held from 9 to 3. Next month, we will also have another webinar presented in partnership with the Elder Justice Coalition titled White House Conference on Hunger, Nutrition, and Health. That will be held on December 15th from 1 to 2. You can register for these events and more on our website, www.benrose.org. There you can also find more information about all of Benjamin Rose's research, services, and programs. Thank you, and we hope you have a great rest of your day.